Hi everybody, it's Dr. Dimitri from Bulis Acupuncture Clinic here in Larnaca, and today we're going to demonstrate our approach on treating Achilles tendinopathy. Now, if you've ever had Achilles tendinopathy, you know that it's a very slow healing process, and our goal is to help speed things up so you can go back to moving and feeling great without any kind of pain. So there are three parts to the treatment process. Number one is we want to perform acupuncture in order to help reduce our pain and also help increase blood flow to the site of injury. The second part is that we want to provide manual therapy, okay? So we want to loosen up and reduce tension in the tissues that are actually causing the Achilles tendinopathy in the first place. And the third part will be rehabilitation exercises. So we're going to give the patient specific exercises that they're going to do here at the office as well as at home in order to help speed up the recovery and make sure that we prevent re-injury from occurring and also strengthen the area to support the ankle rather than cause more of a problem. We found that when we combine these three into sports injuries, whether it's for a lower back or a shoulder injury or an ankle injury, or in this case, Achilles tendinopathy, we get much better and faster results that are long lasting. Okay, we have Dr. Anna here demonstrating the Achilles tendinopathy treatment. So we have the needles with the Electro-Acupuncture onto the calf muscles, and our goal here is to help reduce pain, but also help loosen up the muscle tension that the patient's experiencing typically in the calf muscles. And that tension tends to actually start pulling on that Achilles tendon. And here we have a couple of needles right by the Achilles tendon, right where the patient would normally feel pain. And our goal here is to help speed up the healing process. Okay, so now we're going to demonstrate the manual therapy techniques that we would use for Achilles tendinopathy. Now, we don't want to stretch out the calf muscles because that's going to actually put a lot of pressure on the Achilles tendon. So one of the ways we help reduce tension in the calf muscles and in the lower leg in general for patients that do have Achilles tendinopathy is we like to do deep tissue massage techniques. So I'm going to just demonstrate a couple of techniques that we do here. Now, this is deep tissue, but it shouldn't be excruciating to the patient. So we start with some techniques just to kind of warm up the muscle, increase the circulation, and then we can go into kind of deeper strokes to the patient's tolerance, of course. And the goal here again is to reduce that tension in the calf muscles without stretching the Achilles tendon. One of my favorite techniques I like to do is kind of going over with a loose fist. Of course, we use a variety of manual techniques. These are just examples. And it's also extremely important to emphasize that not all Achilles tendinopathy cases are going to get treated the same. Proper evaluation needs to be taken prior to administering any kind of treatment. So this is just an example of how we would treat a patient that has Achilles tendinopathy. Okay, so now we're in the rehab stage. We've done our acupuncture to help reduce pain because the acupuncture helps release the natural endorphins. We help increase blood flow into the Achilles tendon area, and that's going to help speed up the healing process, reduce any kind of inflammation, degeneration. And we did our manual therapy to help reduce any kind of tension in the calf muscles or the lower leg that actually puts pressure on the Achilles tendon. Now it's time for the rehabilitation exercises, okay? So the first thing that Dr. Anna is going to do is we're going to do something called heel raises, or toe raises. So we're going to go up onto our toes nice and slow, as much far up as we can, and we're going to come down nice and slow. So the goal here is to emphasize on the going down portion, on the eccentric portion. So we're going to go up again, and then down nice and slow. Now it's key here to note that Dr. Anna, I've seen a lot of people do this on steps, but Dr. Anna is not doing this on the step, because if we do this on the step and the heel drops below the step, it actually will put pressure on the Achilles tendon and irritate it even more. So we want to do this on a flat surface, not on a step, and make sure that she emphasizes on the going down portion and comes right back up. Let's do it one more time. And then back down again. Very good. So usually we start at 3 sets of 10 repetitions. Okay, so now the next exercise that we're going to demonstrate is a little bit of a progression. And the reason why we're going to perform this exercise, which is the basic lunge, is because the Achilles tendon has to accelerate and decelerate. So the lunge is a perfect exercise to do for this. And this is again more an advanced type of exercise that we do further down in the rehabilitation process. But the first part of the lunge is going to be just a simple short lunge. So let's go into the lunge, go down a little bit, and then come back up. So she's not going very deep into the lunge. As her tendon gets stronger, we can go a little bit deeper into that lunge. And when we go deeper, we have the knee move a little bit further closer to the toes. We're going to get more of a stretch on that Achilles tendon, which is something that we want to do a little bit later on, more tension onto the tendon. Tendons love to be loaded. They don't want to be stretched. So this exercise is going to be really good to help, again, re-educate on deceleration and acceleration. It's also really challenging her balance and her proprioception and her foot. When we have a foot or an ankle injury, the body tends to change how the feet move in order to avoid any kind of pain. So you're good. So when that happens, we want to re-educate the foot on how to move properly in order to avoid any kind of re-injury, and we can help speed up that healing process. All right, everybody, so that was essentially a demonstration on how we treat Achilles tendinopathy in order to help speed up the healing process. If you have any questions at all, please feel free to email us, call us. You can schedule a complimentary consultation at our clinic, and we'll be more than happy to review your case and see if there's anything that we can do to help you feel better and move better. Also, if you would like some more information on treating Achilles tendinopathy and some extra tips, don't forget to check out our blog on our website at www.bullasacuclinic.com.